Hey everyone, thank you for joining me, Laura Wayman, the Dementia Whisperer, for my weekly Facebook Live show. You know, dementia is not a specific disease. It's an overall term that describes a group of symptoms associated with a decline in thinking skills severe enough to reduce a person's ability to perform everyday activities. So what's behind these dementia symptoms? Well, our brains are always trying to make sense of things, to impose order on all the information we're continuously taking in. But when an individual has dementia symptoms, whole experiences are constantly being lost, making it difficult for the brain to get its bearings. In plain language, the essential parts of the brain that we access and utilize in order to understand the world around us, every piece of data we receive, process, and put to use to do anything, is now broken. And with most causes, it will continue to be even more and more broken. So the way I like to describe this is that the person presenting dementia symptoms has a broken thinker, and to become dementia aware is to learn to think for them. Dementia in its various manifestations, for example, issues with cognition, behavior, mood, psychological changes, muscle memory loss. These are a list of symptoms very much like a cough or fever are common symptoms of the flu. But if you have a cough, it doesn't necessarily mean you have lung cancer as the cause of that cough. And if you have dementia symptoms, it does not necessarily mean the cause of your dementia symptoms is Alzheimer's disease. The cough could be a symptom of respiratory influenza or allergies, and dementia symptoms could be one of several caused by a stroke, for example. Dementia is often confused with Alzheimer's, but Alzheimer's is a disease or a cause, and the various manifestations of the word dementia are symptoms, either of the leading cause of dementia, Alzheimer's disease, or of another disease or disorder, or even exposure to a toxin, or a reaction to certain medications, or ongoing infections. There are over 100 types or causes of dementia symptoms. Some of the more widely known types are, of course, Alzheimer's disease, the leading cause, but there's dementia with Lewy body or Lewy body dementia. There's Parkinson's disease, frontotemporal dementia, Pick's disease, Creutzfeldt-Jacobs disease, which is CJD, normal pressure hydrocephalus, NPH, Huntington's disease, HD, Wernicke-Korsakoff syndrome. Or it's even possible to have dual diagnoses or mixed dementia, such as Alzheimer's and vascular dementia occurring at the same time. And the various types or causes of dementia symptoms have different warning signs, different rates of progression, and different behavioral changes, which is one reason why it's important to get an accurate diagnosis of the type or cause of dementia. An accurate diagnosis means that the person with the dementia symptoms and his or her caregivers can learn more about the likely, although not certain, progression in the person with that specific cause of dementia symptoms. Dementia symptoms vary depending on the cause, but common signs and symptoms include cognitive changes, often memory loss, but not always, which is usually noticed by a spouse or someone else. Difficulty communicating or finding words. Difficulty with visual and spatial abilities, such as getting lost while driving, even if you're in a familiar place as before. Difficulty reasoning or problem solving. Difficulty handling complex tasks. Difficulty with planning and organizing. Difficulty with coordination, balance, and motor functions. Confusion and just general disorientation. And you may experience psychological changes such as personality changes, depression, anxiety, inappropriate behavior, paranoia, agitation, hallucinations. The symptoms of dementia can be better managed with appropriate and clear understanding and a customized care approach. In other words, becoming dementia aware. And there needs to be an understanding that the many causes of dementia symptoms, most of them are not curable. Being dementia aware allows you to have richer and more meaningful interactions with someone dealing with dementia symptoms, which allows you as a caregiver to better support them. Here are 5 ways that caregivers can become more dementia aware so that they can help those with dementia feel safer, more secure, loved, and valued. Number 1, do the thinking for them. It helps to think of people with dementia symptoms as having a broken thinker and the inability to process all of the pieces of data that are coming to them at any given moment from the world around them. By doing the thinking for them, we can fill in the gaps and thereby limit frustration and fear. Number 2, avoid asking questions. Answering questions requires the ability to process the question in the first place, and when someone doesn't have this capability, it causes anxiety. Try to avoid asking questions when possible to eliminate this as a source of anxiety. Number 3, choose information carefully. Think about how much information is really necessary to share at any given time. Even things that most of us take for granted, such as coordinating body movements and balance, require our minds to process and think. Filtering out unnecessary information from a situation will allow your loved one, client, resident, patient to focus on the task at hand and use positive action statements. If you need to ask a question, think of the answer first and identify the desired outcome and lead with that. Include positive language. For example, instead of asking, should we fold the laundry, try saying, let's fold the laundry together, and then commend them for doing it with you. Number 5, join them in their feelings. To develop a sense of trust, join those in your care with the feelings they are feeling. This means validating what they're feeling, even if you're not feeling the same thing. If something is frightening to them, that's their reality in that moment. And showing them it's okay to feel that way will remove a lot of that fear and uncertainty in most situations. You know, I go further into dementia-aware strategies in my book, A Loving Approach to Dementia Care, 2nd edition, published by Johns Hopkins University Press, or visit my website, laurawayman.com. There you will find online training resources to help you become more dementia aware. And I also offer phone, Skype, or Zoom consultations in order to provide you with customized solutions to your own dementia care challenges. So reach out to me. You can reach out to me at help@laurawayman.com. A simple email. Let's develop together a care plan and bring solutions to each other together on your individual dementia care journey, or as a professional, your organization, or as a first responder. Reach out to me. I have all of these wonderful resources. Signing off for now, with love, the Dementia Whisperer.